Miscarriages, a lot of the times, happen for reasons completely out of your control. So please be kind to yourself. Hello and welcome once again aboard JulieCity. As usual, I'm always excited to be here, and I'm glad you are here. Thank you for clicking to watch today's video. You're highly appreciated. So in continuation with our pregnancy care series, I'm going to be discussing a very emotional topic, and that is the loss of a pregnancy, or what we call miscarriage. I will encourage you to grab a cup of tea, water, or any healthy drink. Sit down and let's talk about it. Now, the loss of a pregnancy is usually a really hard and emotional thing. Nobody wants to go through that. But people do go through it, and it's important we talk about it, as hard as it might be. I will start by saying that because it is called a miscarriage does not mean that the woman concerned did or did not do something. A miscarriage is completely, most of the time, out of the woman's control. And I want to just stop and say something to that woman listening to me who has suffered a or a few miscarriages. It has nothing to do with what you did right or what you didn't do at all. It is also known as a spontaneous abortion, and by that it means that it was something out of the woman's control a lot of the time, according to research. There are so many reasons why miscarriages will happen. But research says that a lot of miscarriage will happen on or before 20 weeks of pregnancy. Now, that does not mean that there are no miscarriages that happen after this week, but majority will happen roundabout or before 20 weeks pregnancy. So please be kind to yourself if you have experienced any of this. Now, how women express the issue of miscarriage has a lot to do with their personality and culture. A lot to do with culture. In some culture, you just get on with it and don't talk about it. However, it does not mean that the emotions and the grief involved does not occur. But somehow, women have been forced to swallow those emotions. But now we know better, and that's why it's important to talk about it. So those who have experienced it or may experience it will not feel like they are alone or they've done something wrong. First is chemical miscarriage. Chemical miscarriage or pregnancy loss. One experiences the miscarriage really early, like around the 5th week of pregnancy. And it's sometimes difficult to actually recognize whether it did happen or not. But usually it comes with an experience of a delayed menstrual period, heavier bleeding, menstrual cramps a week or more after one should have had their period. It also is that situation where on a pregnancy test one is positive and 1 week later one begins to test negative. That type of loss really early is known as a chemical pregnancy, and this happens sometimes as a result of chromosomal abnormality. Now I will break that down. Simply put, chromosomes are 46 for every human being, half from mom and half from dad. So 23 from mom, 23 from dad, which makes up the 46 that every human being needs at the beginning of life, which is conception, to develop and grow effectively. So when those structural books of development and growth is not complete or is missing really early in the pregnancy, nature has a way of just letting that pregnancy go, and that is recognized as chemical pregnancy, miscarriage. As the name implies, a missed miscarriage may come without a symptom, so no bleeding, no cramping, like absolutely nothing. It only happens when one goes for a scan and it is discovered that there is no heartbeat. A missed miscarriage is common between 5 to 12 weeks and even up to 20 weeks of pregnancy. The next one is complete miscarriage. Complete miscarriage, as the name implies, means that one experiences the full symptoms of miscarriage, including bleeding, intense abdominal cramping, and also passes the particles of the developing fetus. This is usually confirmed by an ultrasound. The next pregnancy loss is ectopic pregnancy. Now, I have done a full video of ectopic pregnancy. I will encourage you to watch that to get the full story. But basically, ectopic pregnancy means that the pregnancy started very well. However, the developing child was unable to make it to the uterus where it should, but stops in the fallopian tube and is unable to grow further because the fallopian tube is not built to accommodate a full pregnancy. Again, we look at miscarriages that happen as a result of problems with placenta. I've done a few videos regarding placentas, so please watch them as well to get a better understanding of the placenta and how it works. Now, if there's a problem at the early stages of pregnancy with the developing of the placenta, then nature might also decide to discontinue that pregnancy. This will in turn lead to a miscarriage. So far, we've looked at early miscarriages or early pregnancy losses, and the last point I'm going to be discussing in this segment will be the second trimester miscarriage. So, miscarriage that happens later on in pregnancy after 20 weeks of pregnancy. Miscarriage is miscarriage no matter when it happens. However, the longer a woman carries her pregnancy, the more she gets attached. So with the second trimester, it can be extraordinarily devastating. This is that miscarriage that happens as a result of a few reasons, which could be as a result of medical reasons, pre-existing medical conditions from kidney to heart, diabetes, high blood pressure, reproductive health infections, gonorrhea, syphilis, chlamydia, German measles, medication. Some medications are not very pregnancy friendly, so that is why it's important to consult your doctor before taking any medications during pregnancy or even generally. Also, food poisoning can lead to a miscarriage. Again, I will stay here. It is not what you did or what you didn't do. These things do happen. The structure of the womb or the shape of the womb, which is out of any woman's control, can lead to second trimester miscarriage. Weakened cervix can also be a cause of second trimester miscarriage, where the cervix is unable to stay closed but begins to open. These and more are some of the causes of second trimester miscarriage. The other type of miscarriage that I will not fail to discuss in this video is recurrent miscarriage. Now, there are people who have or will experience not just one miscarriage, but will have consecutive miscarriages. Like I said, this is a really emotional topic, but it does happen. It is devastating to have one miscarriage, but to have it subsequently, that person needs support. So it's important that you seek help and that you seek professional help accordingly. Recovering from pregnancy loss involves both physical and emotional healing. Whether it is a chemical pregnancy or it's a second trimester pregnancy does not take away the pain or the grief that one feels emotionally and cannot be belittled by anyone. Grief is different for everyone, and how you grieve is completely personal to you. Some might experience early pregnancy loss, like chemical pregnancy, and are completely devastated. Others might experience a second trimester loss and are able to carry on. But either way, emotions are involved and should never be belittled or silenced. The presence and support of loved ones and family members and friends are immensely valuable. It's also important to seek professional help and counseling if and when needed. I'll also say here that there are people who have experienced a miscarriage and gone on to have subsequent normal pregnancies. I, for one, am a witness. I experienced a first early pregnancy loss and I went on to have 3 healthy babies. With the right medical support, people do end up having their own pregnancy. Whatever happens, the bottom line is the fact that you seek medical support early to avoid stories that touch. The only thing you should not do is to suffer in silence or self-blame. Blame yourself for what has happened. Now, I'll also speak to family, loved ones, and friends. If you know anyone who has suffered a miscarriage, it's not the time to begin to recount for them their sins and tell them why you think they caused their miscarriage. Mock or laugh, because research even shows that a lot of the miscarriages were caused by reasons outside or beyond the woman's control. It's time to be there to listen and support them as required. And please don't make them deny what has happened. Acknowledge their loss and their grief and give them support as needed. There are many resources out there that can be accessed by anyone who has suffered a miscarriage and is struggling to cope. Contact your midwife, your doctor, check online, look around the local. You'll be able to find support that is suitable for you. Don't be tied down by culture. Put yourself first and seek help as required. Like I said, there are people who have gone on to have a beautiful family even after a loss. If you're experiencing a pregnancy loss, I want you to know the rainbow comes up after a heavy storm. So there is hope for tomorrow. Yes, your emotions are completely valid. Your sadness is real. And what happened is real, irrespective of what stage that pregnancy is. But there is hope for tomorrow. Healing is a journey. So take one day at a time, one step at a time, and seek help as needed. I hope you have enjoyed watching this video. If you have, I want you to give it a like, leave a comment, share your story, or share a word of encouragement for those who will be watching this video. Remember to subscribe if you have not, and share. That way, those who would benefit immensely from this video will get to watch it. Till I see you next time, don't forget, your health is your wealth. Bye-bye. Don't forget to click on these videos coming up. I'm sure you will find them insightful. Bye.